Evening, ladies and gentlemen. This is David Mandel, OHEL Children's Home and Family Services, and it's our pleasure to invite you to this evening's webinar titled Reimagining Alcohol Use on Purim. I'd like to begin by thanking my colleagues, Sivi Ryder, Cheryl Chernovsky, Tammy Kornfeld, and Laura Bart for preparing and organizing this evening's webinar, as they do each one of our webinars that we have every 2 or 3 weeks. This evening's webinar will have 3 distinguished panelists discussing alcohol use and alcohol abuse on Purim. OHEL's webinars are on a range of issues. The last several we've had dealt with grief, trauma, stillborn children, unfortunately, the grief of losing a child, and they were well attended, well responded to. We felt this evening, given the upcoming holiday, the upcoming Chag and Purim, this was an important conversation. OHEL Zakta Family National Trauma Center, the Brescia Family South Florida Trauma Services, and the Kestenbaum Family International Children's Services respond to a plethora of issues throughout the country and worldwide dealing with various trauma, crisis intervention, grief conversations, which we hope are not needed by anyone and certainly not revolving around Purim. The reason that we felt tonight's conversation was important is because every single year, bar none, there are difficult, even tragic situations that occur over the holiday of Purim, in which people, unfortunately, lose their ability and have excessive involvement in drinking or driving or anything of the sort. So tonight's conversation is on managing, curtailing, and preventing any such difficult situations. How does one celebrate Purim? OHEL is not lecturing individuals on not to celebrate Purim. OHEL is not suggesting by any means not to enjoy the holiday of Purim. On the contrary, it is one of the most festive holidays of the year, of the Jewish year. It includes an important meal, people getting together in whatever way they do, family, friends, and enjoying the holiday. The Lubavitcher Rebbe, Rabbi Nachum Mendel Schneerson, wrote several decades ago that the holiday of Purim, we know that there is a saying that one should imbibe until they don't know the difference between Mordechai and Haman. People understand that in many different ways. The Lubavitcher Rebbe wrote many decades ago that one fulfills the obligation of Purim at the Seudah, at the meal on Purim Day, at any time that you have it, by having a drink. He spoke about it in the singular. By having a drink at the Purim meal, at the Purim festival, and one fulfills their obligation for the Purim holiday. My colleagues this evening that I'd like to introduce first is Dr. Shalom Ogenbaum, OHEL's substance abuse specialist. He holds a PhD in clinical social work. Shalom is a credentialed alcoholism and substance abuse counselor, a CASAC. In his work, Dr. Ogenbaum maintains a whole person view regardless of the specific issue at hand. He maintains a private practice in New York and New Jersey, in addition to his important work at OHEL, and he's excited for the release of his upcoming book, Inside Outside Parenting, which is due out later this year. In a short while, I will also introduce Dr. Joseph Nissenfeld and Dr. Sophia Jojulius after Dr. Vogenbaum. Dr. Vogenbaum, good evening. It's a pleasure to welcome you.
Hi, good evening, David. And good evening to my wonderful colleagues and panelists. And of course, a good evening to you, ladies and gentlemen. Firstly, I'd like to acknowledge the audience for taking the time out of your busy schedules to attend tonight's webinar. When Mrs. Civi Ryder emailed me the flyer announcing tonight's event, I read it and it gave me a moment's pause. I thought to myself, Wednesday night, 8:30 to 9:30 p.m., a discussion around alcohol and Purim. And I had to ask myself, Shalom, would you attend? And to be honest with you, and I'm slightly ashamed to admit this, the answer was no, I wouldn't. And of course, then I had to ask myself another very important but uncomfortable question. Why not? I know that I'm not busier than the 200 other people who are in attendance here tonight. I know that alcohol is an issue. After all, I deal with it every day. It's certainly not because of the speakers. Doctors Nissenfeld and Georgioulias are really interesting and knowledgeable, as is Mr. David Mandel. So why not? And the only answer I came up with, and again, I'm slightly embarrassed to say, is that my reaction to a webinar devoted to alcohol and Purim was, come on, not again. Purim, alcohol, haven't we heard enough about this already? Yes, I see the ads put out by Atzala each year around this time. I know all the back and forth about giving Bachram alcohol. This stuff and these speeches have been going on for years, coming out of my ears. I know that alcoholism exists in the Jewish community, even in the Frum community. I get it, okay? And you know something, as I was thinking about it, the truth of the matter is that that's an understandable reaction. Whenever a new message or an idea is introduced, spoken about, addressed, at first, it's novel, it's new, it's fresh. But over time, we grow so accustomed that it just becomes another word that begins to lose its potency. And so people aren't as moved by a webinar devoted to alcohol, alcoholism, Purim, especially nowadays with all the chatter around marijuana, the opioid epidemic, and now fentanyl. Alcohol has kind of taken a back seat in people's minds. This was actually driven home to me last month when I had the extraordinarily wonderful opportunity to sit in on a meeting of the United Task Force, which is a collection of all the major Jewish organizations, mental health clinics, agencies, institutions. There must have been about 40 people sitting around an extremely large and long table hosted by OHEL and its CEO, David Mandel. And each organization spoke about their past year of services, updating everybody else in the room about the trends that they were seeing and the ways to be prepared for the future. I found it absolutely fascinating. I mean, just think about it. On average, each organization services close to 10,000 Jews a year. And there were 40 of us sitting in that room, right? Just imagine that for a minute. And so as they were discussing the issues, one woman, and I don't remember her name or which organization she belonged to, but one woman said something to the effect of, you know, we're getting a lot of women who are struggling with alcohol. And it's not just women from the community, but women in prominent leadership positions, Rebbitzins, community organizers. These are women of tremendous influence. And because of their statuses, there's no place for them to go to seek help, to protect their reputation, to prevent shame, their anonymity. We need to do something about this. And you know what, my friends? There was not a gasp, not a collective sigh. And as I looked around the room, I saw not one face registering surprise. And it was just like, yeah, this is alcohol. This is some of the issues of alcohol that we've been talking about all these years. And so, my dear audience, you can understand why me and my fellow panelists' jobs here tonight is a bit difficult. We've almost reached the point where alcohol use and the dangers of alcohol have become old news. The fact that I and many others in my position have treated Roshei Yeshivas, Roshei Kololim, Rabbanim, Rebbitzins, successful business people, men, women, adolescents. The fact that a Rav today has to worry that if he tries to institute a limit on the amount of alcohol served at Kedushin, he'll either lose his job or half of his kehillah, half of his organization will leave. The fact that organizers of spiritual events for yeshivas or shuls worry about attendance if alcohol isn't served. All of this is old news. Certainly not enough of an attraction to be curious about a webinar about alcohol. And I'm ashamed to say that I'm guilty of that as well. And yet, here we are. 200 people are on with us now. Obviously, then, this topic has relevance to you, or perhaps a family member, a friend, a loved one. And so I ask the Ribbono Shel Olam that the ideas and the thoughts that are presented tonight illuminate some area, provide you with some guidance on what you who are here tonight might be seeking. So what is my angle here tonight? I'm not going to spend a lot of time talking about people who have an alcohol disorder diagnosis or those who are in active recovery. I'll just say this. If you or a family member or a friend or a loved one are in early or even long-term recovery, please plan ahead. Whatever that looks like for you. For some, that may mean making sure that you're not in an environment where people are drinking. I have several friends who are recovering alcoholics who stay in their homes the entire Purim. It's harsh, it's difficult, I know, but for them it's necessary. They tell me, Shalom, if I go outside, I feel like I'm walking into one big bar. If I go to other people's homes, I feel like I'm walking into one big liquor store. Recovery from alcohol tends to be a serious business. But part of recovery is learning how to have fun. Is it possible to experience Purim without drinking? Absolutely. Is it possible to attain spiritual heights without the assistance of alcohol? I think you know the answer to that. You know, I'll share with you a story. Several years ago, I had the unique and wonderful experience of hosting a Purim party, but this was no ordinary Purim party. You see, 20 or so of the attendees, the people who were coming, were all in rehab. And so I rented a large office in New Jersey, and I waited as the bus pulled up, and 20 or so men and women got off the bus and came directly into the office. And we had delicious food set up. We had a wonderful Suda, a wonderful meal together with good. The ambiance was beautiful. The camaraderie was joyful. And then at the very end, I dimmed the lights and I asked everyone to sit around in a circle. And I pushed play on my iPod that was connected to this large speaker. And I allowed the slow, soul-stirring music to play. And then an amazing thing happened. As the lights were dim, one by one, people began to join in and sing for over an hour. 20 men and women, all of who grew up in very frum families, were from extremely frum communities, and now they were not religious, sporting tattoos and hairstyles and dress that was the furthest thing from appearing Jewish, began chanting timeless words of the psukim that they hadn't uttered in years. Shifri kamayim libech. I pour out my heart like water to you, Hashem. Ezri me'im Hashem oisei shemayim v'aretz. My help, my assistance, my strength comes from you, God. There wasn't a soul in the room that wasn't elevated. There wasn't an eye in the room that wasn't crying. And after we were done, a young woman, close to 30 years old, approaches me and she says, Shalom, This is the first time in my life that I felt connected to Yiddishkeit. I asked everyone to stand up, and together we recited the Shehecheyanu. Baruch atah Hashem, Shehecheyanu v'kiyamanu v'higiyanu lazman hazeh. What a powerful moment. And so yes, if you are in recovery, it is absolutely possible to experience the avoda of Purim without alcohol. I'd like to spend the rest of my time, and David, please let me know if I'm going over time, because I want to be respectful to the other esteemed panelists. I'd like to spend the rest of my time briefly addressing those who don't have an alcohol problem and focus on 3 ideas, perhaps touching on 2 now and the 3rd one later. Is it possible to drink safely and responsibly? And how should I approach my team? And then what is considered a problem? So is it possible to drink safely and responsibly? The short answer is yes, it is, of course. But we have to first define responsible drinking. Responsible drinking is not just how much you're drinking, how fast you're drinking, about having a designated driver or partner. Of course, it's that, but it's more. Responsible drinking is an attitude or a philosophy, if you will. And we have to ask ourselves, as adults, men and women, what is our attitude towards the bottle? When I was growing up, I remember as a 3-year-old, I picked up a bug and was about to ingest it, put it into my mouth, and all of a sudden my mother starts yelling with such forcefulness, "Ugh, Fed, don't eat that." At that forcefulness, I carried that sense of revulsion for the remainder of my life. That to this day, if I find a bug in my soup or in my cup, I'll spill out the drink, and then I'll wash out the cup before drinking again. Such is the power of a parent's genuine conviction. And so we need to ask ourselves, what is our attitude towards alcohol? It doesn't have to be ach and fe, but do we make love to our liquor? Is alcohol more than a drink? Perhaps. Is it more than a davar sheva kedusha, an object or a vehicle towards spirituality? Perhaps as a status symbol? Is it a glorification of some sort? When I speak to some people, because I'm in the field, you could literally see a change in their demeanor when they talk about alcohol. Their face lights up, they become passionate, animated, alive. I want to share with you some interesting research that was undertaken by an incredible woman, Dr. Rivka Schwartz, who I never met. Anyways, Dr. Schwartz is a principal of SAR High School, which is a modern Orthodox co-educational high school in the Bronx. And she and her research team set out to better understand substance use among our high schoolers. They just wanted to know what passes for normal nowadays use for a modern Orthodox adolescents. What are the rates? What's going on? And so between the 2 years of 2019 and 2020, she and her team surveyed 20 modern Orthodox schools, high schools. And she administered these surveys to the 10th and the 12th graders using a survey that was created and used by the national government to gather data about substance use among American teenagers. And so she was able to use the data to determine 2 things. Number 1, the substance use in our community. And number 2, we also will have a baseline, an American baseline of data with which we can compare ourselves to see where our students stand and how they measure up with secular society and the national average. And like all research studies, they started out with a hypothesis, an assumption about what the data would show. And they thought that the data is certainly going to show that our kids, the main issue that we're having is marijuana and vaping. Not so. They were proven wrong by the data. The data showed that marijuana and vaping among our adolescents was meaningfully lower than the national average in 2019 and 2020. But what they did find was that our kids, our adolescents' rates of drinking alcohol were higher than the national average, and that binge drinking, 4 or 5 or more drinks in one sitting, was substantially higher than the national average. Can you imagine that? Kids in our system are more likely to binge drink than the national average American teen. For 10th graders, it was 11% higher. And for 12th graders, meaningfully higher than that. And so what they saw is that the older our kids are getting, the more they're diverging from the national average. Now, this trajectory is frightening and should give us pause. We need to ask ourselves, why alcohol? And there are probably many answers. One of the possible answers that I'd like to suggest tonight is that as a community, we consume, we give access to, and we model a lot of alcohol use, be it either in a frum context, Simchas Torah, Purim, Kedushin, Farbrengens, weddings, bar mitzvahs, Tayameh, and in a social context. And our kids watch us and absorb our attitude. Several years ago, my son went to a friend's house and he sent me a text of a picture of a beautiful room furnished in beautiful mahogany wood, filled wall to wall with alcohol bottles. Okay? What was most telling to me wasn't the room. It was the excitement and the pride his 15-year-old friend had when showing my son the room. And of course, we could say, what goes on in my home is my business. And that's certainly true. You're certainly entitled to your opinion. But drinking responsibly means that we have an understanding that we are part of a system and that what we do has ripple effects on the rest of the system. Drinking responsibly means we need to be mindful and intentional when we drink, to ask ourselves, what is my relationship with the bottle? And how am I, as an individual that's part of a system, part of a community, part of a neighborhood, part of a family, how might we be contributing to this perception of what it means to drink? And so when I'm asked, how do I talk to my teen? The truth is, the question doesn't start with, how do we talk to our teens? The question is, how and what should we be modeling for our child? Of course, we have to talk to them as well. And as my esteemed colleague, Dr. Carly Namdar once said, kids are great observers, but poor interpreters. And they need us as parents, as adults, to give them an accurate narrative about what they're seeing. Otherwise, they'll come to some pretty wild and wrong conclusions. So talk to your team, explain to them your concerns, if you have any, about alcohol, about drinking on Purim, about what it's supposed to mean, about the role of alcohol. And so if you're listening, if you're here tonight, I know you definitely had a life before this webinar, and you'll have one after. My hope is the manner in which we live it perhaps will be changed in some ways by some of these ideas. For some of you, the changes might be more subtle. For others, perhaps more profound. When I was told about I was going to present about a webinar on alcohol and Purim, I approached a therapist friend of mine and I asked him, what do you think about the idea of devoting a whole hour to alcohol? And he said, listen, Shalom, you've got to speak about other drugs. People in our community aren't dying of alcohol. And I say, yes, perhaps they aren't dying, but are they living? Are they living meaningfully? Let's make it so that the next time we make a l'chaim and we say to life, we do it meaningfully and intentionally. Thank you for listening. That's all I got.
Thank you very much, Dr. Shalom Morgenbaum. And just to do a quick review, you spoke about the fact that alcohol takes a back seat to drugs, especially the national crisis of fentanyl. You spoke about how there are more women struggling today with the issue of alcohol, how to drink responsibly. We're not suggesting that people not have a drink, not enjoy. You spoke about drinking responsibly. You commented on a study by Rivka Schwartz, the principal of SAR, a well-known school in Riverdale. Her research showed that binge drinking amongst 11th and 12th graders was unfortunately more prevalent than the national average which completely is consistent with Dr. Abraham Twersky, may he rest in peace, spoke about 40 years ago when he founded Gateway Rehabilitation in Pennsylvania, and he was the founding director. And he liked to say, whatever goes on in the general community goes on in the Jewish community. And he spoke about the issue of destigmatizing alcohol and drug abuse in the Jewish community. I'm sorry. Thank you, Dr. Orgenbaum. It's my privilege to introduce Dr. Joseph Nissenfeld, a psychiatrist with additional board certification in the field of addiction psychiatry. Let me just interrupt myself, actually, and say to everyone, if anyone has any questions or comments, feel free to use the chat, the Q&A function, or the chat function, and we'll be sure to get to your questions. And following the webinar, we'll be sending out an evaluation form to all the participants. And we ask you to take literally 2 minutes to complete it. And your responses help us schedule subsequent seminars. Dr. Nissenfeld, a psychiatrist with additional board certification in the field of addiction psychiatry. He currently serves as the medical director of Achieve Behavioral Health, a community behavioral health center located in Rockland County that treats both mental health as well as substance abuse issues, working with my dear colleague, Dr. Yitzi Schechter. Prior to coming to Achieve, Dr. Nissenfeld worked at Bellevue Hospital for 10 years, where he was responsible for psychiatric treatment in the methadone clinic, chemical dependency outpatient program, and then as interim director for the Division of Substance Abuse. Dr. Nissenfeld certainly knows what he is discussing in the issue of substance abuse and substance abuse. Dr. Nissenfeld.
Thank you very much, David, for that introduction. And it really is a pleasure to be part of this wonderful panel, and truly an honor to be speaking to all of you who joined. As Dr. Orgenbaum said, it's a remarkable investment to take out the time and listen to this. I was inspired, as I'm sure all of you were, in listening to the words of Dr. Orgenbaum and the sobering but inspirational perspective. As the medical professional on the panel, I'm going to bring it down a little bit to some nitty-gritty details. And I think what I hope to accomplish in the time that I'm sharing with you now is to share some basic information to help organize a way to approach drinking on Purim and in general, to be a little bit more knowledgeable about some of the medical and biological aspects of alcohol, and then, as they used to say, to be an educated consumer, so you can make healthy and good decisions. In specific, I'm going to focus on the question that was posed in the flyer, which is it possible to drink safely and responsibly on Purim? As we started off saying, this is not a lecture on what you should or shouldn't do, but to help guide a way of approaching this. So I think there are, as was said, some clear instances where the answer would be emphatically, no, it's not safe to drink on Purim. Again, Dr. Orgenbaum mentioned a scenario of someone newly in recovery, someone with an existing alcohol use problem. So certainly for someone like that, it could potentially be very dangerous and something to seriously consider and have a plan. Of course, again, as we all know, if you're planning on driving, underage children, it's dangerous under all circumstances. It's very hard to know when you've hit that level where the alcohol is starting to impair and affect your ability to drive. And it often happens earlier than we think it's happening. And it takes longer to recover from the alcohol than we think it's going to take. So, needless to say, those are instances where, of course, it's not safe to be drinking. I want to add to that also another consideration is anyone taking medication. That's again another serious question to consider. Of course, speak with your own doctor, but in particular, specific medications that can be problematic and increase the risk that's associated with alcohol are medications like benzodiazepines, Xanax, Klonopin, those sorts of medications, sleeping pills, pain medication, opioid pain medications. Those are all things that can work synergistically with alcohol and enhance the potentially dangerous effects of alcohol. So certainly anyone who's taking those kinds of medications, again, speak with your doctor, those are dangerous combinations. And someone with serious or significant medical or psychiatric problems should really have a thoughtful approach to this. Again, as was said, that doesn't mean that you can't enjoy Purim. It doesn't mean that it's something that needs to be miserable, but there's a way to do it safely. So assuming you don't fit in any of those categories, so how is it safe to drink? Or as people often ask me, if I'm going to drink, how many drinks can I have? And that's it's a hard question to answer. There's no one right answer for anyone, and it really depends on a lot of factors. So I'm going to provide some general information to help at least organize this. It depends on a number of different issues. And the way our bodies absorb the alcohol, process it, the way it affects us, depends on a number of things. Number one, it depends on males versus female. So we know if a man and a woman have the exact same amount of alcohol, it will affect a woman and more significantly than it does a man. It's just the way that the alcohol is absorbed and processed in the body. It depends on your age. It depends on your weight. Someone who weighs more can drink more without having the same effect as someone who weighs less. It depends on if you've eaten food before you drink. It depends on how quickly you drink. If you have many shots one after another, it's going to have more of an impact than if it's spread out. And as we said before, it depends on any other medications you might be taking and if you have any other medical issues. So you can't, it's hard to give an exact number, but again, we can give some basic guidelines. So if we're asking what's a safe number of drinks, so the first question to ask is, how do you define a drink? So is a drink, is it a shot glass? Is it my coffee cup filled with whiskey? Is it a large Kiddush cup filled with whiskey? What do we mean when we say a drink? And there's actually a standard definition for that we use here in the United States, and it's different in different countries. But here, what we mean when we say a drink is anything that adds up to 14 grams of alcohol. Now, I'm sure no one is going to be sitting there measuring or trying to figure out how many grams of alcohol. What that translates into real life is essentially a 12-ounce can of beer, a shot of whiskey, 1.5 ounces, a standard shot, or a 5-ounce glass of wine. So those, again, just to get a basic conception, that's what we consider a drink. All of those things are equal to one drink. Of course, depending on how much alcohol is in it, it'll be a little bit more, a little bit less. That's essentially what we're talking about. What's a safe amount and what's not a safe amount? So again, as Dr. Augenbaum said, binge drinking is defined as 5 drinks for a male, 4 drinks for a female at any one occasion. So if you're having that much alcohol at one time, that's already considered binge drinking by the NIAAA, the National Institute for Alcoholism and Alcohol Abuse. Now, that doesn't mean if you do that once a year on Purim, it's a problem. But if it's something that's happening consistently, it's happening at a Kiddush every week or during the week, then at that point, the chances that it's a problem increases substantially. And it's something that really needs to be looked at and discussed. But that's one criteria, that's one threshold that we have. 5 drinks for a male, 4 drinks for a female at any one time. That already crosses a threshold and into more dangerous territory. And again, that's assuming you're not drinking every day. If someone is drinking every day, it's a different story. Now, what about on Purim? I don't do this all the time. So at what point do I hit a certain level of alcohol that's dangerous? And there are really 2 different ways of looking at this. I think there's the question, at what point does the alcohol begin to impair my ability to do things like driving and function? At one point, is it really potentially dangerous? And in some cases can be lethal. So I'm going to give you just two or three samples, basic general examples. Again, this doesn't apply to every single person, but just to get a basic idea. So if we're talking about, let's say, if you're a 200-pound male, that's the average weight of the American male, according to Google. If you're a 200-pound male, and this goes by your real weight, not the weight you tell other people, for someone like that, after 3 drinks, you're already having some impairment in your ability to drive safely. And if you would be pulled over after 3 drinks, you could potentially get jail time and a serious fine for driving with that much. That's not a lot, but that already affects your ability to drive. After 4 drinks, you would already, again, this is a general equation, looking at a general equation, after 4 drinks, it would already be considered intoxicated, which would be a WDI, which is very serious. And then the dangerous territory where it can start to cause serious, significant medical problems is closer to 13 drinks, in which, if you think about it in terms of you drinking wine, that's, let's say, 2 bottles of wine. So that's already when it becomes serious. Now, before that, of course, it might be nauseous and vomiting and may not be pleasant to be around, but it gets dangerous at those later points. To bring it down, let's say you're 150 pounds, then it's 2 or 3 drinks until you're intoxicated and can't drive, and 10 drinks until it's dangerous. And if you're a female, it's 8 drinks. And let's say you're a young adult or a teenager who's at 120 pounds. Again, we said it depends on weight. If you're 120 pounds, it could be as little as 2 drinks that brings you to the level of intoxication for DWI, and as little as 7 drinks where it can start to be dangerous, especially if you drink it one after another very quickly. So that's not, it gives, there's some room to drink on Purim and to do it safely, but it's within reason. And again, depending on your weight and other issues, it's important to really be mindful of how much that is. I want to end by just sharing 2 more points. Number one is that if you are someone that does struggle with alcohol use, there's treatment. Oh, there's a wonderful place that provides treatment. There's therapy, there's medication, there's groups. There are ways of doing. There's medication that can help limit the amount of alcohol that you drink if you do want to drink, but not to excessive amounts. So there are a lot of options for help out there. And finally, just to reinforce the point, again, referencing back to Dr. Augerman, who made many wonderful points, a key factor really is about our relationship to alcohol and our perception to it. There's a lot of literature that suggests the reason why traditionally, and unfortunately it's changed, but traditionally there were perhaps lower rates of alcohol use. It's unfortunately not the same anymore within the Jewish community, was because alcohol was introduced to children in a very controlled, ritualized, symbolic, significant way through Kiddush, Seder. Unfortunately, that's changed now as it's gone outside of that. But the more we're able to interact with alcohol and view it as something that is a meaningful part of our life and is as I've said, a tashmish kedusha, a way of enhancing our life in a meaningful and important and spiritual way, the more likely we are to use it in a safe way for ourselves and to teach our children to learn safe ways of using alcohol as well, so that we can all live healthy, happy, and fulfilled lives. Again, thank you all for joining.
Dr. Nissenfeld, thank you very much for educating our audience on how to drink responsibly. You spoke about what is a safe number to drink, and you interpreted what it means in grams in terms of a glass of wine, a bottle of beer, or a glass of whiskey, or whatever one's choice of drink is. It depends how you define a drink. And you spoke about binge drinking, an important conversation similar to Dr. Rogenbaum. At any one consecutive successive time, 5 drinks for a male, 4 drinks for a female, whatever their choice of drink is, whether it's 5 glasses of wine, 5 bottles of beer, 5 shots, whatever it is. And also, of course, a very important comment, if you struggle with alcohol, there are excellent treatment options, medication options to help individuals. Thank you very much, Dr. Nissenfeld. It's a pleasure to turn to our colleague at OHEL, Dr. Sophia Georgioulias, who has a multicultural background, which has granted her a special sensitivity and interest in working with individuals from diverse backgrounds. Trilingual in English, Greek, and Spanish, Dr. Georgioulias has devoted her career to understanding and treating substance abuse. She's held a variety of positions, including Director of the Metropolitan Center Substance Abuse and Mental Health Clinic, and her current position is Director of Substance Abuse Services at OHEL. She also has a private practice, provided trainings and workshops on substance use, motivational interviewing, and harm reduction. Dr. Sophia Georgioulias, it's a pleasure for you to join us this evening.
Thank you for having me. I'm very honored to be on this panel. And hopefully I can contribute by talking a little bit about the level of care and the treatment options that are available. So there's no one size that fits all for treatment to addiction and to alcoholism. Sometimes people think, well, if I don't drink excessively or I don't wake up drinking, that I don't have a problem with alcohol. But that isn't necessarily the case. Someone can drink just on occasions, drink excessively, keep forgetting where they parked their car, or get into some legal trouble and then not pick up again. When we talk about alcohol use, there are levels, mild, moderate, and severe. And I just want to give some information on the different types of treatment out there. So people don't think I have to be completely addicted to a substance to get help, because there's things that you can do. Often we talk about denial. People sometimes struggle to admit it to themselves. Also, there's other barriers like stigma, where people never get the treatment because there's barriers that prevent them from doing so. But there is treatment available and to fit your need. So when we often hear about what we call level of care, which is sometimes very confusing, but many of you have heard detox. So detox would be probably one of the highest levels of care, where someone would go if they were dependent on a substance and they needed like 24-hour supervision. Then you would have, you could have early intervention where, maybe it's a problem, but before it becomes excessive, you want to go and talk about it. Or maybe it's one of your children that, you're starting to see a pattern, or they change in their behavior. So there's early intervention where you can just go and get treatment just to talk about that and get education, about it. There's the next level is inpatient, where, typically after someone goes to detox, where, if someone has been drinking a lot, they require medical attention. They then would finish that treatment there, and then they'll go to inpatient, where there's more help and more support. Sometimes it's very hard, obviously if someone's got a job and can't leave their job, it's very unrealistic that they could go to an inpatient center. But if you did have the time, or you could, if someone had severe problem and wanted to change the people, places, and things, then an inpatient setting is kind of going somewhere, removing themselves away from their current world, but getting that 24-hour supervision. And that's what people refer to as inpatient care. So then there's the outpatient. So, I don't know if, who this applies to, if anybody, but, maybe you're a working person that, wants to address their drinking because maybe it's affecting their relationship. Maybe they're, acting a little bit recklessly. The outpatient model, which is my favorite, and that's not just because I'm the director of the outpatient program, but it's a program where someone can come and it's non-intensive. You don't have to stay there. You can go to work and come to the program. You can see your clinician once a week, talk about things that are upsetting you in your relationships, how alcohol is affecting you, and work with the therapist to focus on triggers and coping strategies. Then there's also groups available in this kind of setting where it's not supervised. You just go and basically connect with other individuals suffering. And that's more of a non-intensive setting. So pretty much when people talk about levels of care, we want to match up, what someone's problem is with the level that's required. Now, if someone goes to a treatment program, that doesn't mean, it's going to be a success rate. It means that there's many factors that come into play here, and that is, does that person want to be in treatment? Are they going because their families said telling them to go, or are they going because they really want to be there? Yeah, so all of these play a role. And if you not sure what level, if you're curious or you think you've got a problem, but you're not sure, you don't have to determine that level of care. So this is why there's programs, like ours are available where, what typically happens is someone comes into a setting where, screenings are provided where the clinician who's credentialed and a professional can screen to find out, what level one person, a person is on. So this might not be applicable to anybody, but we just wanted to talk a little bit about what options there are out there. And, if you're maybe a parent who is worried that you can, your child doesn't want to come into a program, if you could just get them through the doors, us as professionals, we're trained on how to engage them. We're trained on using evidence-based approaches to kind of meet them where they're at, and maybe they don't stay, but maybe now they know that this option is available. So yeah, so that's just what I wanted to talk about with regards to like what is available. I know for our program, we also have for OHEL's new substance use disorder services, we don't just provide help for the individual, but also for the family. So we are very aware that the family member can struggle just as much. So if you are struggling, with dealing with a loved one's use, we do have available family support as well. So yeah, that's pretty much just what I wanted to share this evening.
Thank you very much. Thank you very much, Sophia, my colleague, Dr. Joe Julius. Just to quickly review, you emphasized the importance of those individuals who needed to seek outpatient counseling, which is to see your addiction specialist once a week. It might affect an individual who's going about his or her life in a daily way, working, whatever's going on, but they have this issue that they need to deal with. It may be affecting their relationships. And you distinguish between those individuals who have a more serious issue that require inpatient support where it interrupts their life. And you talked about how counseling, outpatient as well as inpatient, helps not only the individual, but also helps their family provide support. Any individual that's going through any type of mental health crisis, including an addiction to substance, drug, alcohol abuse, the return back also involves the support with the family. We have a number of questions that have been submitted in advance of this evening, and I'd like to start with you, Sophia, Dr. Joe Julius, on the following question, which has been asked many times in many different permutations. The question concerns from parents about their teenage children, the teenage son specifically. This is a very common question, not surprising in general and related to Purim. Sophia, my teenage son wants to go out with his friends. I would like him to go. How can I tell him not to go? The peer pressure of going. I don't want him to be embarrassed. I don't want to have a fight with them. But how can I send him or let him go? Not that a 15, 17-year-old is going to stay home, so to speak, and not be nervous that he's going to drink. What can I tell him to help him feel to be safe and not succumb to peer pressure? Dr. Joe Julius.
Yeah, that's a great question. As parents, we like to have control. We want to, keep our children safe, and that's, one of our main roles, right? And then as we see our child grow and have their own personality, that becomes scary. You want to control. You're like, no, don't go there. Don't go with that person. I'm a strong advocate of motivational interviewing, which pretty much means meeting someone where they're at and instead of giving that, don't go, don't do this, which often leads to them doing the opposite, is basically trying to just give them the facts and say, listen, I know you're going to go. If you're going to go, like, be safe, and you can discuss different, things that could potentially go wrong, but you want them to know that they can come to you, and no matter what, like, if there's a problem, you can call me. I'm not going to scream at you. I want you to be aware of just provide the education. Like, people are spiking drinks. People are, be mindful where you leave your drink. Be mindful, obviously, if they're underage, they're not going to be drinking, but, they might be tempted to. And if they do, you'd rather that they turn to you if they are in a situation where they get in some kind of trouble. So, yeah, it's scary as a parent to think that, because you never want them to do anything, but you definitely want them to know that they can always turn back to you, and that you'll still protect them.
I think it's important that you said that drinks can be spiked and that you're never sure what you're drinking if somebody hands it to you. Dr. Nissenfeld spoke about the different content of drinks. There is a scotch that's 80 proof. There's scotch that's 100 proof. There's scotch that's 120 proof. And you can do that with every drink. Maybe a good answer I would add to that, Dr. Joe Julius, is know what you're drinking. Maybe if you want to have a drink, maybe pour your own drink. Dr. Nissenfeld, I'd like to go in the other direction for a second. So I'm a 17-year-old, I really don't want to drink. I don't need a drink. I want to be at the party. I don't want to be left out. But like everybody else is drinking. It's Purim. How do I not drink, Dr. Nissenfeld?
That's an excellent question. Before I answer, just to go back for a second, to answer an easier question, when we say one drink as a shot of whiskey, that's 80 proof. So you're absolutely right. That's if it's a more higher alcohol content, it's going to be a lot more. It's a tough question. There's no easy answer. It's a lot of, I think, modeling, trying to. Meaning this is not a question that you start dealing with the second your child is going out the door to the party. This is something that starts way before that, in terms of teaching an appropriate way of viewing drug use and alcohol use, of teaching children an appropriate way of dealing with peers and how to deal, because it's not just drinking. There's peer pressure in all sorts of areas. Giving children the ability, the strength, and the tools and the skills to be able to navigate those difficult situations. That's something that we can be teaching our children already from a young age, with other areas as well. Kids are throwing stones at cars going by in the street, and do you do that with them or not? And how do you negotiate that? So these are conversations we can start having earlier, and then of course when it comes time for this sort of conversation to have, being aware of where are they going, what's going to be happening there. Is it a safe environment? Is it not a safe environment? Are we including our children in our own Purim celebration? Am I so focused on my drinking that my kid's miserable and that's why he's going to his own party to drink with his friends? Or am I approaching it in a way that includes the family, that makes it an enjoyable experience for them as well, that they don't have to do that? So I guess my answer would be, it's best to avoid that situation by working in the larger context, and trying to develop healthy ways of viewing it and having a place for the children in the family where they feel comfortable being there.
Dr. Loganbaum, I'd like to talk about binge drinking for a second, because people may not understand that binge drinking that you and Dr. Nissenfeld spoke about can lead to alcohol poisoning. You drink quickly a certain amount of drinks, regardless, irrespective of, how tall or your weight or anything that's going on, especially if you're just taking some very strong shots in successive order. We've heard every single year from Hatzalah, the response in certain situations that people got alcohol poisoning because of the amount they consumed in a short amount of time. So in your field of work, you three professionals, is something called harm reduction. So let's talk about harm reduction for a second, Dr. Orgenbaum, where this may sound a little bit strange to parents listening, but let's give some practical advice. We're not stopping people from drinking completely on Purim. Let's be practical. It is a mitzvah, it is an obligation to have some drinking on Purim. Strange as it may sound, that's part of the holiday of Purim. Okay? Give us a talk about harm reduction very briefly, Dr. Orgenbaum, because we have a few important questions. How to manage and control your intake so that you can drink, but carefully. Dr. Orgenbaum.
Yeah, sure. So just for those who are unfamiliar with the concept, harm reduction, the idea of harm reduction is focuses on reducing harm related to alcohol or substance use by encouraging the individual or individuals to determine their substance use or alcohol use goals that are not necessarily related to abstinence only. And so, for example, a classic example would be for a host who's having Bahram coming over to his or her house to be able to put out alcohol, but to monitor or limit the amount of drinks that kids can have or the amount of alcohol that's just available. And so I know of places where there are actually bouncers walking around, and to the best of their ability, they're screening the amount of alcohol the kids are imbibing or are consuming. So that would be one way. I would. That's the idea. It's the idea of being able to say, listen, this is a day that people will drink. We acknowledge that, but let's do so in a way that limits the amount of danger and, God forbid, cases where people need the services of Hatzalah, etc.
So
I just want to go back for 1 second because I think it's important to the question you asked, Dr. Nissenfeld, very quickly. There are some options in therapy when we deal with a kid that says, I don't want to drink, but I'm going to feel pressured by my friends. We would do assertiveness training. And so we would engage them in drink refusal skills. We'd actually role play, and parents could do this. It could be fun. You could be creative about it, teaching your child how to say no. And that is very difficult for even adults to do. And so early on, way before Purim, you can begin engaging them. You can make it a family thing where you start saying things that are very pressuring, and you have the child repeat no or some other very curt, brief, polite response. The other thing is that there are non-alcoholic beverages that do look like alcohol. And so if you're a responsible host, you could put those out and put a little sign there. And so anyone that really doesn't want to drink but doesn't want to give in to the idea of just being the odd person out could be walking around nursing a bottle that's really non-alcoholic. That's just some practical things I think are some we could incorporate today.
We've had a couple of people comment to us about the stigma of not drinking. Could you imagine how far we've gone in the conversation about stigma, that now people are saying, I don't want to be the last one out. I don't want to be the nerd. I don't want to be the one that's talking about look at him, he's not drinking. So, hold a cup in your hand. Put in a half an ounce of vodka, a half an ounce of tequila, and 4 ounces of, whatever you want to add it with. So you can honestly say, I'm joining you for a drink. I'm joining you for l'chaim. It doesn't have to be 4 ounces of anything that you want. I love the fact that people are now, that our community has come to a point where people are talking about the stigma of not drinking. That's such an education to the community. It's such a reversal, which is really, really wonderful. Somebody talked about modeling. So just a comment. It is hard, Dr. Orgenbaum mentioned earlier. We are not lecturing anybody. We're really not. OHEL is in the business of educating OHEL is not in the business of lecturing. None of us are lecturing anybody. It is hard to say to a 17-year-old, when you're going out on Purim, I don't want you to drink tonight, when you literally have 42 bottles of whatever, fill in the blank, in your cupboard, whatever, so on and so forth. That's a comment. Okay, a question asked by several women. Dr. Julius, how do I stop my husband from drinking? And the question is not asked specifically just about the holiday of Purim. Dr. Julius, you come from several other cultures, not necessarily the Jewish community. So this is not a Jewish question only. How do I stop my husband from drinking, Sophia?
You can't. So basically, as I mentioned before, you can encourage someone to go get the help. You can tell them, look, I really want you to do this, or I'll leave you, or you can give them all these consequences, but the individual has to want to change themselves, and they have to have the desire to change. You can share how you feel. You can, ask him to join you or her to see a professional where, someone can guide you both in, and maybe with a neutral person, your loved one can see how their substance use is hurting you or hurting the family. But, there's a lot of barriers to that. The individual has to want to change. If they're very dependent, they're going to need to get help before they can even think clearly. If they've been drinking so much, their body's under attack. So they're not thinking logically how they're hurting others. And, it's important that people don't take, their loved ones' use personally, because sometimes that happens. And it's like, why are you doing this to me? Why won't you stop? And, it's a disease. Now we know more about it. It's a disease. So what you can do is basically, try to understand that more about addiction for yourself. You can't change him, but you can change yourself and how you deal with your situation by understanding that there's also help for you. Addiction is not just an individual problem. It affects the family as a whole. And, one of the, like I mentioned earlier, one of the aspects of OHEL's substance use program that I'm really proud of is the family component. Like, yes, you can come and do group therapy with your loved one or couples therapy, but it's more than that. You can actually see a therapist to deal with your pain, because eventually the loved one ends up so sick, worrying about their loved one, that they've got their own addiction to the loved one's wellness. So maybe not change him. You can influence change. And that could be the change for that person eventually, but it's best to probably focus on trying to change yourself and how you deal with that situation.
I remember, it's got to be 15 years ago, someone called me and asked me what they need to do with a person in the family who was drinking, and they were concerned that they were going to harm themselves. So the first comment I made is, make sure that they don't drive. Take away the keys, whatever that means, take away the keys to the car. And they called me back and they said that didn't seem to work. And I asked them to describe their family constellation. And this happened to have been an older person that they were speaking about. And they talked about how this person's favorite time was to be with the grandchildren. And I remember saying to them, if the taking away the keys to the car doesn't work, then take away their time with their grandchildren. As severe as that recommendation was, take away the thing they enjoy the most. Take away the thing they love the most. Make it really, really a reverse crisis moment. So that's my thought that comes to mind. Individuals who would like support, assistance in the services that were described this evening by Dr. Nissenfeld, by Dr. Julius, by Dr. Orgenbaum, are welcome to contact OHEL at ohelfamily.org or Addiction Services at ohelfamily.org. Addiction services at ohelfamily.org or ohelfamily.org. We want to thank everyone for joining us this evening on the conversation, Reimagining Alcohol Substance Use. You know, we can say substance abuse, alcohol abuse, or we can say alcohol use. So the conversation goes from abusing alcohol irresponsibly to using alcohol responsibly. Thank you, our esteemed panelists, to my colleagues for joining us this evening. Everyone will be getting an evaluation. We ask you to take literally 2 minutes to complete it. It'll help us. We're not sending you a gift certificate for completing it. We're just asking you to take a moment to complete it. Dr. Nissenfeld from Achieve, continue your amazing work. Dr. Joe Julius, Dr. Orgenbaum, my colleagues at OHEL, thank you very much. Everyone, have a wonderful, enjoyable, safe holiday of Purim. Good evening.
Thank you so much. Bye-bye.